Okay, let's continue with what we have discussed today. Let's talk about the word adaptation and coping and stress, right? We failed to discuss that. We as humans were exposed to a lot of stress, whether physical stress, chemical stress, emotional stress, and our body has the tendency to adapt, right? Now remember the word General Adaptation Syndrome? Okay? In the Gel Adaptation Syndrome, I'm just trying to review what are the stages here. You have what? Alarm, followed by what?
Resistance.
Resistance, right? Followed by what?
Exhaustion.
Exhaustion, right? In alarm, it's essentially your what? Fight and flight, right? Fight and flight. What is involved here is what? Is it sympathetic or parasympathetic? Sympathetic nervous system, wherein the nervous system involves the use of what? The release of what? Cortisol, remember? Now remember, cortisol is your glucocorticoid, remember? And what does it do to your blood glucose levels? Elevates. It's a glucocorticoid from the word gluco, which means glucose. Why do you want to have high levels of glucose? What is the glucose a source of what?
Energy.
So that you can what? Survive in a sympathetic fight or flight response. The goal is to survive, right? So you need glucocorticoids in the form of cortisol from your adrenal cortex, right? What about from the adrenal medulla? You have your what? Epinephrine, right? And this is going, and together with norepinephrine, what does it do?
Constrict blood cells.
It will increase your what? Heart rate. Why do you want to increase your heart rate?
Few more oxygen.
To pump more blood where? To the leg muscle that you can what? Run away. More blood supply to the brain, heart and lungs. Would you like to have more blood supply to your skin? No, because the vital organ should be given more priority because your goal is to flight. What is flight? Get out of the stressful situation. Like for example, I'm 5 feet 9 and 3/4. Shaquille O'Neal is 7 feet 2 inches. Or Yao Ming is 7 feet 6 inches. Who is bigger and taller? Shaquille and Yao. If I were to be in a fight with them, what are the chances that I will survive? 0. So what do? Run away. That's the most important thing. Let's say in road rage incidents along the freeways here in California, are you going to confront your aggressor? No, you don't. What do? Ignore. Run away. Okay? Because if that guy has a gun, what do? Are you going to tell him, shoot me, shoot me? And he shoots you and you ask him, why did you shoot me? Isn't that common? Okay. So now we need to know about this. So here, you have high levels of cortisol, high levels of epinephrine. What happens in resistance? This tends to normalize, right? Okay? And of course, the levels normalize, but at the same time, you have to remember that you have to be able to adapt to the situation, right? Adaptation is necessary or to cope in order to survive, right? Your pupils will what? Dilate. In exhaustion, high levels goes up, then suddenly it gets depleted. You have already no way to be able to overcome, and that's the reason why you end up becoming sick or develop a disease pattern, right? Do you understand? Okay? So when you fail to adapt, then you have the disease pattern. I give you an example. When you have gastroenteritis, what does it mean? Gastro means stomach, enteritis means inflammation of the GI tract to the small intestine. There is increased peristalsis. You lose a lot of what? Water in your stool. Guess what? What will the body try to do? If you lose water in the stool, what will the body try to do? Try to what? Retain water through the kidneys, right? What hormones will be involved here? Antidiuretic hormone from the hypothalamus, produced by the hypothalamus, stored in the posterior lobe of the pituitary gland, which will travel to the blood, to the kidney, telling the kidney to retain water. What's the other hormone? From the adrenal cortex. Aldosterone. What does aldosterone do? Retain water too. Why do you want to retain the water? Because you want to what? Develop what? Homeostasis, balance. Why? You're trying to cope. Why? In diarrhea, you lose water. What will those two hormones do? Tells the kidney to retain water, hopefully to normalize. Now what happens if your two hormones were not able to adapt and cope with the situation? You develop dehydration. And what happens when you're dehydrated? You lose a lot of water in your body. Remember, 66% of your body weight is water. If you say, then that's around what? 6 to 8 liters of blood. If you lose 2 liters of water in your stool, will that affect your blood volume? Yes, it's called hypovolemia. Hypo, low, volume, emia means blood. And you might develop hypovolemic shock. So what do we do in the hospital? Are we going to rehydrate, give IV fluids and oral fluids? Yes, to rehydrate, right? Do you understand? Why? Because your body is not sufficiently able to bring about homeostasis. We have to intervene by giving IV fluid this time. Does that make sense? Is that clear? Okay? Now remember also, in our book, we talked about, so this is the Gel Adaptation Syndrome. We talked about the importance of knowing the organs involved here, right? We talked about when there is stress and stressors, right? You are able to excite what? The receptors, right? Right? And then, of course, in your body, there are a lot of baroreceptors and everything for fluids, balance, and blood pressure. And it stimulates the hypothalamus to release what? Corticotropin releasing hormone. And then it will affect the what? Anterior lobe of the pituitary gland to release what? ACTH. Now remember, both of these are in the brain, hypothalamus and your anterior lobe of the pituitary gland. Now what does the ACTH do? Affects the adrenal what? Cortex. And what are the two hormones there? Glucocorticoid, which is cortisol, and what's the other one? Mineralocorticoid, which is the aldosterone. And what does cortisol do? Increase your blood glucose levels. Do you understand, class? Okay? So the bottom line, therefore, is that this is necessary to be able to survive. Now, aside from this, will this also affect your sympathetic response? And therefore will affect your adrenal what? Medulla, right? And then what does the medulla secrete? Epinephrine and norepinephrine. We talked about what happens, right? Increase heart rate to pump more blood to the legs so you can run away. At the same time, pupillary dilation. And of course, bronchodilation. Do you understand? The goal is to survive. You want to open up the airways by bronchodilating them. You have to increase the heart rate to pump more blood to the leg muscle so you can run away. And more blood to the brain and vital organs, less blood to the skin, which is not a priority at this point in time. What about your peristalsis? Faster or slower in a sympathetic response? Slower, because you want to be constipated. Why? Because there is no time to make poo-poo. Can you imagine the building is on fire and you will raise on Dr. Gamo before we get out of it, can I make poo-poo first? No, your body will adapt. How? By decreasing what? Peristalsis. You become constipated. When you get out, you look for the nearest McDonald's and make poo-poo there, right? What about your bladder muscles? Relax or contract? Relax or contract? Contract. So when you're leaving the building here, you're making wee-wee. Is that the right thing to do? So what do you think the muscles here will do? Relax. Why do you want the muscles to relax? To be able to store what? The urine, because there's no time to make wee-wee. So you want the urine to be stored there, but the sphincters must be tight. Can you imagine if you are in a high-rise building and the building is on fire, and you're going down the stairs and you're making wee-wee, shh. There's no time. Everybody will just slide and everybody will fall, right? Slipped. So apparently the body will try to adapt by making you what? Store. And how can you store the urine inside the bladder wall? By making the muscles what? Relax. It's called detrusor muscle, right? In the wall. Remember the word detrusor? Where did we learn this again? Anatomy. So sympathetic will make this muscle relax. As long as the sphincters are tight, the urine will not flow because there's no time to make wee-wee in a burning building or a stressful situation, and you end up going out. Do you understand? Okay? So the goal is to survive from alarm, resistance, exhaustion, and all these hormones and substances that are released in order to cope. Be aware of them, okay? Now what else? We also talked about cellular injury. Some of them are reversible and irreversible, okay? The first, when you say reversible
Hydropic swelling.
versus irreversible. Here, the cells are not dead yet. Irreversible cell injury, the cells are dead. Nothing you can do, okay? The first example is hydropic. What does hydro mean?
Water.
Very good, okay? Hydro means water. What is the damaged part of the cell here? The sodium what?
Potassium.
The pump. Now remember, what is the sodium-potassium pump? Is it a form of active transport or passive?
Active.
Why? Because it requires what?
Against the continuation.
It requires what?
ATP.
ATP, which is energy, because you are moving substances from an area of what?
High,
Low
low.
to?
High.
On the other hand, what is passive transport? From high to low. Exemplified by diffusion. Diffusion is defined as the movement of substances from an area of high concentration to low. Does it require ATP? No. What is osmosis? Diffusion of what? Water and water alone. From high water concentration to what? To low water concentration. Do you understand? Okay? Now, in hydropic swelling, what happens is this. Let's give an example. Let's say the heart. This is the aorta here, from the left ventricle, right? What are the arteries coming from the aorta? They want to provide blood supply to the myocardium or the cardiac muscle cells. We call them coronary arteries. How many do we have? 2. Left and right coronary arteries. Let's say the right coronary has fat deposits. What will the fat deposit do? What happens to the lumen or the passageway of the blood? Narrower. So if there's narrow, what happens to the blood flow here in this area of the muscle cells? Decrease what? Blood flow. What's another word for decreased blood flow? Ischemia. So is there going to be myocardial ischemia here? Okay, now remember, this decreased blood flow, and what kind of blood do you find in the coronary arteries? Oxygenated or deoxygenated? Oxygenated. So you decrease oxygen. Now remember, in the production or formation of ATP, do you need oxygen? To be more effective, you need oxygen. Remember, in the cell, the Krebs cycle, citric acid cycle, not only do you need glucose, protein, carbohydrates, but you need what? To produce ATP where? What part of the cell produces ATP? Very good. Okay? So if there is a lack of oxygen to the myocardial cells, will you be able to produce enough ATP? No. When there is not enough ATP, will that affect the pump? Yes. Now what does the pump do? From low to high, where do you find more sodium? Outside of the cell. So apparently the sodium is being pumped by the pump from inside to outside. How many of sodium atoms are pumped out?
2.
3. We can't afford to be wrong here. Okay? This is very basic anatomy and physiology. What about potassium? 2. From low, outside, high, inside. Low to high, going out. From low to high. How many of potassium? 2. How many of sodium?
3.
Now remember, the movement is different. Sodium is being pumped out. Potassium is pumped in. From low to high for sodium. That's the reason why you always have more sodium outside because of the pump. You will always have more potassium inside because of the pump again that requires what? ATP. Now what happens in myocardial ischemia? Will there be enough oxygen to produce ATP? Decrease oxygen, decrease ATP. When there is decreased ATP, will that affect the sodium-potassium pump? Definitely, right? So what happens now is that the sodium is not being brought out. The sodium remains where? Inside the cell. So wherever sodium is, water will what? Follow. So water will go inside the cell becomes swollen. Is that called hydropic swelling? Yes, it is. Now, what's another example of reversible injury of the cell?
intracellular accumulation.
Perfect. So when there's something wrong with certain enzymes in the cell, it can cause accumulation. But that's still reversible if you can come up with something to correct the chemical reaction not taking place. On the other hand, what's an example of irreversible? When you have necrosis, right?
Necrosis.
Okay. In necrosis, how can necrosis occur here? Very simple. From ischemia, as time goes by, you have more fat deposit there after 1 or 2 years. You have chest pain, but when the fat deposit becomes bigger, what happens to the blood flow? They become slower, and the blood forms a what? Blood clot. What does the blood clot and fat deposit do? Completely block the flow of blood, thereby there is no blood flow, zero blood flow, and zero oxygen. The cells will die. It's called what? Infarction of the myocardial tissue or necrosis. Infarct means no blood flow, no oxygen, the cells will die. Is this reversible?
No.
No more, it's irreversible. So from myocardial ischemia to myocardial infarction, can this lead to this? Yes. What tissues are affected? Myocardial, myocardial. Reversible, ischemia is reversible. This one is irreversible. Now here in ischemia you can give what? Drugs to lower what? Your blood cholesterol levels, like your simvastatin, your Lipitor levels, your medication, right? What else? You can give a drug like the one we give under the tongue, nitroglycerin. What does the drug do? Vasodilate. When you vasodilate, you open up the blood vessels. Will that increase the blood flow? It will increase the blood flow. It will relieve the chest pain. Angina is another word for chest pain. That's why these medications called nitroglycerin or medication skin patch or under the tongue sublingually given will actually end up what? Relieving the chest pain. Do you understand? Is that clear? Okay? Are you able to understand what that means? Okay? Now, when you adapt, there are different forms of necrosis. Like, in this particular case, when a blood clot is formed to completely block the flow of blood, what kind of necrosis would that be? Huh? Coagulate is another word for blood clotting. So what's the term? Coagulative necrosis. What about if there is hemorrhagic pancreatitis and it causes lipid damage, destruction? It's called what? Fatty necrosis. What about in tuberculosis? What kind of necrosis would that be? Cassation, right? C-A-S-S-E-A-T-I-O necrosis. What about if you have an abscess formation? What kind of necrosis would that be? Liquefaction necrosis. So I hope you study that part. Now, in terms of adaptation of a cell to any agent, a normal cell, for example, to adapt, you have what? Let's say 5 cells, same size. 1, 2, 3, 4, 5. What is atrophy? Decrease in the size of a cell or tissue or organ. You still have 5, but what happens to the cell? Smaller cells, but still how many? 3, 4, 5, the same. On the other hand, what is hypertrophy, class? Okay, same number, 5, but bigger cells. Still 5. Normal, atrophy, hypertrophy. Now what about hyperplasia? Okay, increase in the number of what? So instead of 5, you could have 10, 12, whatever, okay? Do you understand? That's hyperplasia. What about metaplasia? What is metaplasia, class? A change or what? From one cell type to another cell type, right? So instead of like this, it could be like this, converted to another type of cell. Now, what about dysplasia? Very good. Disorderly what? Growth of the cells. Now, why is this significant to note? What can dysplasia lead to? Cancer is what's called pre-neoplastic, right? P-R-E, neoplastic means it can eventually lead to what? Cancer or malignancy. Do you understand? So the bottom line is that we need to know about these things, about cell injury adaptation, and of course we talked about the reversible, so irreversible, right? And then it's very important, therefore, to know that these are things that we are expecting you to know, right? Okay? Is that clear? Okay? We are ready, so just turn this off.